Well, thank you, Priya, for that introduction, and welcome, Priscilla. Thank you for joining us tonight. It is great to see you.
It is a pleasure to see you too.
Well, thank you. Well, I'd love to start with my first question. I just would very much welcome hearing about your personal journey and what attracted you into medicine, and then how did you end up at UCSF and ZSFG?
For me, medicine was the end of a journey of both loving science, loving biology, being enthralled by learning about the science of how the body works, but more importantly, it was a way to deeply care for others. As a kid, I always knew I loved helping others however I could, and I always knew. I guess I always knew in the future I'd be a pediatrician because I preferred kids to adults. It was a way to be most of service to others in my community. When I was in college, I ran an after-school program, and I was like, okay, I'm in this role, I can support these kids in this community. And then I became a teacher, and then I was like, okay, what is the next best way for me to be of service to others? And it was becoming a physician. I think if we back up all the way through all those different lenses, I remember something that's deeply core to my identity is that I'm the child of refugees. And my parents and my grandparents were boat people, and I like to think that I inherited either the DNA or the epigenetic modification that made a group of people audacious and optimistic enough to know that there was something better in the world for them and their future. And I want to be part of a group of people that all felt that audacious. And I have to say, at the General, people feel that way. People just have this uncanny belief if they're just optimists. Things are not great at the moment. Usually you're not unless you're in labor and delivery, being at the hospital is not one of your greatest days. But especially a lot of the cases at the General. But the heroes, the people who are endlessly, day after day, committed and optimistic, are the people I want to be around and I feel inspired to spend my time with. And so when I got there as a medical student, I was like, I found my people. We all, we all share that gene, that methylated site that makes us passionate and optimistic that we can make someone's life better, a little bit better that day.
That's such an inspiring personal journey for you. And I love the fact that you say, this gene of compassion, if you will, but also audaciousness. So when you think about taking your personal passion and kind of pulling that out with a broader view, how did your time at ZSFG inform your thinking related to healthcare in the United States, and then how that later has informed your philanthropy?
One of the core lessons that I learned at the General is that it's not an isolated, medical breakthrough or technical breakthrough that is going to be the answer to a person's health issue. Sometimes it is, but more often than not, it's a complex constellation of things that make a good health outcome possible. And that's where you have to understand all the factors in a patient's life that bring them to you at this very moment. And whether it's the public transit system, the public health system, the way our workforce is structured, translator services, none of those things are directly related to the delivery of medicine as we traditionally think about it. But at the General, all those things are top of mind, and you have to understand the interplay of those factors when you think about caring for a patient. And I remember living that firsthand myself. When I see the kid at the General who's translating but shouldn't be, that's me. I remember doing that. Or a elderly person clutching a piece of paper that they think has the answer to sort of where they need to go or be, and they speak no English. Those are my grandparents. And honestly, people running late, running multiple jobs. They're my aunties and uncles and parents. And so I remember living that. And at the General, I had the honor of practicing medicine and learning from those who understood this complex interplay in the delivery of medicine. I carry that lesson with me leading CZI, that you have to collaborate, you have to understand the true nature of a problem and the barriers that come in a lot of individuals' everyday lives. And that's staying close to the work, making sure you understand the true nature of the problem and that you're solving the right problems. You have to get out of the lens of the ivory tower solution if you really want to have impact in the community, in society.
Thank you for that, Priscilla. I love how you're describing staying proximate to the problem. And as we stay proximate to the problem, it requires having empathy from very different lenses, as you've described. And so I look at you and I see you as a leader in medicine. I know you're also a leader in education. You're a philanthropist and you're a mother. And so this past year during the pandemic has certainly acutely put forth the issues related to health equity and access to care, just as you were describing. So as those issues have been illuminated over the past 2 years of the pandemic, has that shifted or restructured how you think about your work?
The lesson that we've taken there is that it's another reminder that it's never just one technical solution in addressing a human problem. There was a time when we thought, okay, we've got to develop a vaccine against coronavirus. And amazingly, that did happen. The vaccine did get developed at breakthrough speeds. But the complexity in the often more interesting part of a problem is that we're humans. And you guys are doing the amazing work of vaccinating the communities and making sure that especially those who have the least access to healthcare have access to high quality healthcare for those who are sick with coronavirus, and also preventing infections with the vaccines. But really what it comes down to is really learning and understanding what brings people to certain viewpoints and what are the challenges people face. And honestly, to be frank, our country has not had a perfect record with minorities, people of color, the Black community, when it comes to our ability to deliver science, deliver medicine that meets their needs. And so when we've faced individuals who, question the state of the science or vaccine research, or the millions of other policies we've had to figure out in the past 2 years, I think what, as a leader and as a community member and mother and friend, the first thing that I've tried to train myself to do is to really stop and listen. We all come to this global pandemic with our own experiences, and unless we really stop and understand the perspectives of others, we're never going to get to a place where we solve problems together. And so that's a lesson that the pandemic has highlighted, and hopefully one that I hold on to with all those different hats on in the future.
I know we are going to do our best to get through this, and as we've celebrated the 5th anniversary this year of the new modern acute care hospital, your personal support has really made a difference. There's just no doubt about it, along with those from the community who have supported ZSFG. And with that in mind, there's a real opportunity to think broadly about these big problems that society is facing. And when you think about your personal support and the role of public-private partnerships, So tell me a little bit about how do you think about that partnership and the collective spirit of public-private, and what does that mean to you?
For me, I think that you have to, the two have to come together. And the big public institutions like you guys, you're a force in our community, in our city, that's always, hopefully, with the support of many, will always be there. But I think what the private groups and different philanthropies like ours can do is actually take advantage of the fact that we have speed on our side, we have flexibility, risk capital on our side, and we can help pave the way and move quickly, help fill in when things change in a community, be able to bring in new ideas, new innovations, opportunities for you guys to be able to try new things. And then with that, helping take on that risk, hopefully be able to continue to modernize what the stable infrastructure is at the hospital. And so there's sort of speed, agility, and risk tolerance versus making sure that we have a stable, high quality, state-of-the-art public institution that is the bedrock of public health in San Francisco.
Oh my goodness, that is so well put. And I just love that you're talking about that combination of strategic risk capital, quality improvement, innovation, and disrupting where it needs to take place, but also just recognizing there's everyday patient care that needs to happen, and that
Absolutely.
balance.
It's the balance, and it's the understanding. For me, what I've learned working with you guys is sometimes it's an incredibly small number of dollars compared to your overall budget that can make a huge difference, because there's so much that's rightfully, needs to be earmarked for patient care and facilities and all those, the heroes that we're celebrating today and the work that they need to do. But sometimes surprisingly small in comparison to your overall budget number of dollars can really allow you guys to change and to think differently. And that's where the flexibility of the private-public partnership really is the most magical.
Thank you. It is magical, and your support has been some of that magic dust that has certainly found its way to us, so we are fortunate. My final question to you really is about this spirit of optimism. So what makes you optimistic as you look ahead? And have there been any silver linings? You referenced that earlier this evening, that you've learned from the pandemic as we look ahead to 2022 and beyond.
There are so many powerful moments of people coming together during these past 2 years when everyone's exhausted, tired, scared, and I just think you have to believe in the goodness of humanity and the collective power we all bring together, and people craving the ability to connect again. And so, I look at all those moments in light of what's happened. That's powerful. And if we can really remember that and hold that spirit when the world is less heavy, I'm so optimistic about what can happen. And I think we've all understood more how critical basic science research is, how awe-inspiring it is, how critical the public health system is. None of us will ever take a nurse, a technician, a physician for granted ever again after seeing what they have been willing to do for us day after day for the past 2 years. The depths of understanding and the gratitude that we hold in our hearts for these groups, that has to change us as a society, and it will, teach us so many more lessons along the way that we haven't uncovered yet. So that's what I think the silver lining has to be. Oh gosh, and don't get me started, teachers. Like, I don't think a single parent in the world will ever take a teacher for granted again. It's just been so clear, the mark that they make on our children's lives.
Well, clearly your medical leadership and your education leadership come forth in your spirit of optimism. And with that is such a wonderful, inspirational way for us to conclude our evening and conversation, Priscilla. So thank you for joining me this evening, and thank you for your support. Truly, the investment that you and Mark made to ZSFG was critical this year. And importantly, the gift that the two of you made kept us going during this pandemic, and healthcare continued to happen. So thank you, and we greatly appreciate your support, your optimism, and your vision of the future.
I'm so grateful for the work that you're doing and empowering us to support all the heroes at the hospital. So thank you to you.
Priya, back to you.